All right. So I'm going to administer 7 units of NPH of insulin and 20 milligrams of ketorolac to my patient today. Pulling up their MAR, it is due at 9 a.m., which right now is 9 a.m. Dosage is 7 units, and I have my insulin already pre-drawn up with my label on it of 7 units. It is subcutaneous. My name is on it. My patient's name and birthday is on it. The dosage and the route is also on the label. So I will demonstrate just the ketorolac. The indications for my ketorolac is for acute pain. It is going to be 20 milligrams, which is 1.3 milliliters. Some contraindications of this medication would be GI bleeding or kidney failure. In patient's MAR, she does not have these indications, but I will go ahead and verify that with her. And then for the insulin, it would be for her blood glucose levels if they are elevated due to her diabetes. And then she also has her breakfast coming in the next 30 minutes to an hour. Once this insulin is given, I will go ahead and recheck her blood sugars within an hour to 2 hours. So then going back to my ketorolac, I have 15 milligrams here per 1 milliliter. So I'm going to drop 1.3. I will pop the cap off if there is a cap. I would clean for 30 seconds, making sure I get into all the crevices. The safe dosage rate for this is if the patient weighs more than 50 kilograms, it's 30 milligrams to 60 milligrams is safe. If she's less than 50 kilograms, it would be 15 milligrams. Kilograms. It'd be then 15 milligrams to 30 milligrams. Pulling 1.3 air into my syringe. Going to pull. And I will insert air to air. And I'm going to pull 1.3. I'll make sure I'm pulling slow. I'm going to tap my syringe, make sure there is no air bubbles. And then making sure I'm exactly at 1.3. And going to slowly withdraw. Recap my needle. Make sure I hear that click. Again, no bubbles. I will be labeling my medication with a label that has the patient's name, my name, the time, the dose, and the route on here. I am also going to switch my needles. This would go immediately into a sharps container. All right, so I have my 1.3 ketorolac. I have my 7 units of insulin. The safe dosage for this is 0.4 to 1 units per kilograms a day. All right, so I am going to remove my gloves, perform hand hygiene, and now I'll be going into the room with my medications to the patient. So knock, knock, knock. Hello, my name's Aubrey. I'll be doing your medications today. I'm going to perform privacy. Can you tell me your last name and date of birth?
My last name is Litwack and my date of birth is 051719.
Perfect. I'm also going to verify that on her wristband. All right, so you are getting 2 medications today. You're going to get 1.3 milliliters of ketorolac, which is for acute pain. Can you tell me your pain levels from a scale of 0 to 10?
Right now it's at a 5.
Which is appropriate to give this medication, so we will help with that. Okay. We're also doing your insulin injection today because you are getting your breakfast in about 30 minutes to an hour. This will help with that. And then also I've checked your blood glucose levels. They are on the elevated side, so this will help with that as well. Okay. All right. The things to consider is that if you have any GI bleedings or any kidney failure, this would not be appropriate to give. Are you experiencing either of those today?
I have no history of kidney failure, and my GI system has been completely normal.
Perfect. And then again, you are receiving your lunch within about a half hour to an hour. Your blood glucose is elevated, so we'll be giving this. Once this is given in about an hour to 2 hours, I will take your blood sugars again just to make sure everything is in order. Okay, perfect. So I'm going to ahead and set these down. We're going to perform hand hygiene. Okay, so I can give the IM injection, which is ketorolac, in 3 different locations. I can do deltoid, I can do vastus lateralis, or I can do the ventrogluteal area. Which would you prefer?
I prefer the deltoid.
Okay, just for education purposes, I will demonstrate the other 2. We're going to flip this. Vastus lateralis is going to be in this area right here. Your ventral gluteal will be going about right there. And we're going to go right into that triangle, okay? All right, but we're not going to do that now. We will be doing it in the deltoid, which is your acromion, and then about 3 fingers down, so it'd be around that area, okay? Before I give this medication, I'm going to scan, and then I will scan both of my medications. All right. And then due to the student safety, we'll be performing it over here on a little skin pad. So we're going to go right over here. All right. So we'll start with the subcutaneous. We would clean the area. We would make sure that that is dry. Okay, and we are going to pull away. Make sure we pinch. If it's 1 inch, insert at 45 degrees. Okay. All right. If on a patient, I would make sure that I inspected the area and do it on the opposite side of what the previous medication was given. This would instantly go into a Sharps container. And then for purposes, we'll also now pretend that this is a deltoid per patient's request. Once again, we would clean and we would wait for that to dry. We would insert the needle at a 90 degrees. All right. This does not have a safety mechanism, so I will recap. And again, this will go into Sharps, and I would apply pressure and a Band-Aid. All right, and then that is done. I would go ahead and take off my gloves, hand hygiene. I make sure that the patient's bed is lowered, that they are comfortable. Do you need to use the restroom?
I don't.
No. Your pain is 5 out of 10. With that ketorolac, it should be going down within the next about 30 minutes. Okay. Here's your call light. Your possessions are close by you. Do you need anything else before I go?
No, I'm okay.
Perfect. All right. And I would leave the room and I would document that I gave those medications.